Hello, everyone, and thank you for joining the Thomas Expert Series. We're going to get started here in just a moment, but I wanted to ask everyone to please mute their microphone. This Expert Series will be recorded and placed on demand, so please let your colleagues know how much you enjoyed the presentation today. To get everyone a little familiar with the chat function, where we'll have Q&A later, let me know where you're tuning in from. Maybe what's the weather like out there? I'm in New Jersey and it's bright and sunny. I think it's like 70 degrees, 80 degrees out there. Oh, Chicago's got some smog. Jersey, got a couple Jersey in here. It's beautiful. Philly's beautiful.
Looks like we've got a lot of people tuning in from the East Coast.
Yeah. Got New York in here as well. Smog. All right, I'll go ahead and turn it over to Jory, the assistant product manager, and Marley, the senior product manager, and they're here to talk about safety features, needles, syringes, and med delivery.
All right, awesome. Good afternoon, everybody from, it looks like all East Coasters tuning in today. Thank you so much for attending. Jory and I will be talking today about safety products and the importance of using them throughout practice to prevent needle stick injuries. And just to give, brief introduction, I am Marley Gittles. I am a senior product manager at Soul Millennium, managing all medication delivery. And Jory?
I am the associate product manager for medication delivery, so working alongside Marley to help grow the business and educate clinicians and doctors on how to be the safest when using our products.
Awesome. So jumping right in, before we talk about products and the importance of safety products, we're going to talk about the history and where all these products came to market, really with the intention of protecting you. So, some quick timeline on the legislation behind needle stick prevention in the US. We have in year 2000, President Clinton signed the first piece of legislation to protect 8 million healthcare workers from Sharps injuries. There was a large spike of Sharps injuries, especially during the HIV and AIDS pandemic that was happening. So President Clinton actually signed the first legislation to really bring this into action. In 2006, Canada jumped on board as well and had regulations put in place for needle stick prevention as well. And then you have Brazil to become the first country in Latin America to act on needle stick prevention, which was a huge jump in the right direction, really, moving from North America having a lot of legislation around this to some of the countries in South America jumping on board to really drive prevention. And then in 2011, a year later, Taiwan introduced their legislation to have safety devices be mandated. And then in 2013, the European Union also then became a part of the group of countries who have signed on to ensuring that this was mandatory for all their healthcare workers. And then one of the huge step in the right direction in 2015 was the World Health Organization rolling this policy out to all member states to really make this a worldwide initiative to prevent any needle stick injuries from happening. So to give you a brief overview of why this is so important and the everyday risk that is posed when using needles and syringes is the numbers right on the screen here. So to talk you through some of them, over 20% of conventional syringes with standard or non-safety needles are associated to more than 20% of the needle stick injuries. So 1 in 5 standard needles without a safety feature will result in a needle stick injury. When we had clinicians using safety products and to cover the needle and prevent needle stick injury, 38% reduction in occurrence of needle stick injuries once the safety products were implemented. That's a huge number, 38% in the first 12 months after implementing. So it really shows the effectiveness of using safety needles. Of course, in the United States, the cost of a needle stick injury is significant. One needle stick injury in the US for, based on 2022 research it's $4,352 per needle stick. So you're probably wondering, why is it so expensive if you poke yourself with a needle? But it's really all the testing, the lab work that needs to be done, some of the follow-up in, insurance and liability if something does happen to the clinician or user when using the needle. That's really what's driving a lot of the cost. And then total in the United States, the annual cost is around $400 million to treat needle stick injuries. So you can see here, it's very prevalent in the United States and throughout the world. And using safety products really does drive down a lot of these costs and occurrences from happening. So why use safety products? Obviously, the number one thing is to prevent needle stick injuries from happening. And really the main thing is, why needle sticks are so dangerous is, after you inject that patient with whatever they may need, whatever vaccine or drug, then if you're then transferring that blood from the needle into accidentally your skin, you could contract whatever disease or pathogen that patient could be carrying potentially. So on the screen, you can just see some of the more dangerous risks that you can contract from a needle stick. So not only is it unsafe for you, but it's just general best practice to keep yourself protected from any pathogen, specifically something that would go beneath the skin. So just really briefly, God forbid what to do if you do get stuck with a needle. If you're not using a safety product, not all hospitals have fully converted to safety products, although they should at this point due to legislation. But the number one thing is to act quickly. Treatment is most prevented if you act within 72 hours of getting treated. So the first step would be to wash the site. So you want to rinse the area where the needle stick injury occurred with running water, plenty of soap, and to flush out any of your open extremities like your eyes, your nose, your mouth with water, or even better, a sterile saline to protect and clean out any of those areas. Then the second thing is, of course, really understand what risk you have. So fact check, ask a lot of questions, and find out as much as you can about the person who you potentially got the needle stick prevention or needle stick injury from. Then, of course, you want to get treated. So, getting your labs taken, go to the doctor, and really understand if you're at risk for infection. There's plenty of ways you can treat infection, of course. So shots or inhibitors, or there's also post-exposure prophylaxis. So this is why it's so important to act quickly, because you can get these shots, you can get the treatment to prevent any of these pathogens from progressing past a point you would want them to be. And then lastly, report it. So you want to be able to tell, wherever you're working that this happened. So more than half of accidental injuries and other sharps instruments go unreported. And so reporting it really helps get the right kind of care and helps shape guidelines for the future needle handling. And, if you're using a safety product that might not potentially work that well, then you can really advise to upgrade or change the safety product that you're using to be safer. And then just some general guidelines for preventing. Always make sure that you're using sterile needles or sterile syringes when you are giving an injection. So, making sure that your product has a blister package, does not have any rips in it, and is sterile. That will really help make sure that you're keeping yourself and your patient safe. Don't rush. I know a lot of these are pretty obvious, but take your time. Clinicians are used to having, patients all day long. And so you just want to take your time, because one needle stick could change your life potentially. And then of course, use safety products. So Jory is going to talk about all of our safety needles and how they were designed to really make your lives easier, and keep you as safe as possible during injection. And then two more quick tips and tricks. Don't recap your needles. So that's one of the biggest causes of a needle stick, is if you have a needle that is open, you give your injection, and then you want to take your cap to then cap the needle. Oftentimes you can miss, and then the needle ends up poking you in the finger or somewhere else in your body. So don't recap your needles. Use a safety product that helps to shield that needle safely with your fingers out of the area. And then always use a sharps container, of course. Make sure when you are done with your needle, throw it in the sharps container. Make sure it's contained and away from anyone that could potentially get their hands on it. So I'm going to let Jory talk about some of our fabulous safety products that we designed specifically for you, with you in mind. As you can tell, there's a lot of prevention and legislation that is taking place to help protect you. And some of these products will be your best friend in the future. So I'll hand it off to Jory.
Beautiful. Thank you, Marley. You'll continue to hear throughout the presentation needle stick, because everything that Marley just shared, I'm going to share with you how our products are designed so that we can prevent these type of things from happening. So although all of our products have a lot of features and benefits, I'm going to make sure to really hone in on what's going to keep you all safest when using our products. So we're going to be diving in today to our Soul Care Safety Needle and our Soul Care Safety Needle with Syringe Combo, our Soul Care Safety Syringe with Fixed Needle, our Soul on Blunt Fill and Filter Needle, and then our Soul Guard Safety Syringe with Fixed Needle. And to start it off, we're going to start with the Soul Care Safety Needle. So like I said, a lot of features and benefits, but I'm just going to make sure to cover the things that are most prevalent to preventing needle stick injury. So we'll start with this one. So we have our shield engineered to our hub. And basically what that means is it's going to be extremely hard for you to remove the shield from the needle. Obviously, if the shield does get removed from the needle and you have no way to activate the safety mechanism, then you are at risk of poking yourself or poking someone else along the way while you're going from injection to discarding the needle. So having that engineered on is going to be extremely helpful. You can also see in this image that once the safety mechanism is activated, and I'll get to how to do that on the next slide, don't worry, but the needle is fully encapsulated into the shield. And when Marley and I demo here, you can see that once it's encapsulated, it's not going anywhere. You can't pull it out. It's locked in, and with this shield engineered to the hub, there's no way for the shield to remove itself. So it's completely secure and locked away. And then when it comes to activation, there's two ways to do so. You can see on this slide, you can use your thumb to activate the safety mechanism. So you've got that one hand safety mechanism going on. And then you can also do so with a hard surface by pushing it onto a table and locking it into place. So if you want to keep your hands as far away from the needle as possible, you do have the ability to do so with this product. So with this product specifically, again, just reiterating, the biggest key things here is that we do have that pivoting shield that is engineered to the hub. You can activate it with both your thumb and hard surface. There is a little safety, you can hear it when you're close to it, a little click that you'll know that the safety mechanism has been activated. So not only will you have a visual indication, but you will have an audio indication as well. And then we are going to move on to our Soul Care Safety Needle and Syringe combo. You might be thinking, oh, this looks the same, and that's because it is the same. The only difference with this one is they are packed like this. So it's got the syringe and the safety needle in one blister pack for clinician convenience, and you can use, or you can get it in multiple sizes and different gauge sizes as well. So the syringe and needle will have a bunch of different combinations that you can purchase and then put it in here as well. But the mechanism's the same. The only difference is how it is packaged. And this again just shows the patented locking mechanism for the Soul Care syringe with safety needle. So it allows you to see that we do have the offering of 1 ml to 10 ml, and then the shield will come all the way back while you're doing the injection to ensure that you have clear view into the injection site. So you have the option to get it by itself or as a combination. Then we have our Soul Care Lure Lock safety syringe. So this one is interesting. I remember being in awe the first time I saw it, but there's a few key things to think about when using this product. So it's a syringe with an exchangeable needle, and how it works is you draw up the medication into the syringe, and after injection is really when the safety mechanism starts to come into play. You can inject the medication all the way to the 0 mark without activating the safety mechanism, which ensures that the patient is getting as much of the medication as possible. And then once you're done injecting the patient, what you'll do is you'll take the plunger and push it to past 0. It'll give a little click and lock into place. And then what you'll do is you'll pull the plunger back, and it'll start to retract itself into the barrel. We call this one a manual retractable because you do have the control over when the safety mechanism is activated. You get to put it into the barrel on your own. And then once you have it in the barrel, you can move the plunger side to side and try to push up, and it's not going to go anywhere. It's completely encapsulated into the barrel. Once you're done with that, you can break off the end piece. You can throw your plunger piece into the recycling bin and the needle into the sharps container. So pretty fancy mechanism there, and you'll have no risk once it's completely encapsulated into the barrel. So the one that Marley and I just showed you was an exchangeable needle, meaning that you can take off that size if you wanted to and add a different gauge size, or you can purchase the syringe by itself and put whatever needle size you want on there. But then we also have a safety syringe with fixed needle. So that's where you can't remove the needle. It's mounted onto the syringe. And we have this typically for a lot of our low or our smaller millimeters to maximize the dead space. Which essentially means that you're getting as much medication into the patient since it's a lower dosage to begin with. So that fixed mechanism just allows for a little less room at the top of the syringe when you go to inject. But again, similar to the combo that we have for our Soul Care safety needle, our Soul Care safety syringe with fixed needle has the same functionality. The only difference is that syringe being attached to the top. Then we have our SolGuard safety syringe, and we also have a SolGuard insulin syringe. So these can be used for both of those functions. This is another one that's pretty interesting. So how it works is, let's say that you are putting medication into the syringe, and then you have to go to a different room to administer the insulin or to administer the TB medication. What you'll do, instead of taking the cap and recapping it, because obviously, as Marley mentioned, that can be detrimental. You can either poke yourself and spread it to someone else, or whatever happens in the crossfire. What you do instead is you take this little shield on the outside and push it up and over, and we call this transport mode. So you can carry up to 5 or however many in your hands, or you can put them on a tray and carry them around to where you need to be until you're ready to administer. Once it's time to actually give the medication, you pull the shield down. The needle is obviously back up and exposed for you to be able to insert. You inject the medication into the patient, and once you're done with the syringe completely, you'll take that shield again, push it back up and twist it in either direction, and you're gonna actually lock it into place. So kind of similar looking to our previous item, only this one, instead of pulling it into the barrel, what you're doing is you're taking a piece and extending it up and over to lock it into place. Now we have our blunt fill and blunt filter needles. They look almost the same. The only difference in this is that you can see on the image here that our blunt fill needle with filter does have a filter. I'll talk about that in a second. But the biggest thing to note here is that it does have a 45-degree bevel, so it has a blunt tip. Both Marley and I are touching the tips of the needles right now, and neither of us are getting punctured. And the importance of this is when you go to use it, you'll want to draw up medication from the vial to get it into the syringe. And if you are using a standard hypodermic needle, you have a bunch of different risks associated. One, it could break or bend the needle, which would not be comfortable for the patient, but also from opening the hypodermic to injecting to discarding, there's a lot of opportunity to poke yourself along the way. So this blunt fill needle with this blunt non-penetrating tip allows you to minimize some of that risk and eliminate the time that you're actually using the needle structured for penetration. So that is our standard blunt fill needle. And then we also have our blunt fill needle with filter, and that has a 5-micron filter at the bottom. And what that does is if you're drawing up medication from a glass ampule, the filter will prevent glass, rubber, plastic, whatever the case may be, from getting into the syringe and injecting the patient with whatever particles might be remaining from the ampule. And just again, talking about the clinical risks associated with this, you get particle contamination of the solution that you're injecting into the patient, which obviously wouldn't be good. There would be a lot of complaints about that. And we want to prevent as many issues as possible about people, not only the clinicians using the product, but those who are receiving the injection. We want to make sure that they're safe and that there's nothing, no foreign particles entering their bloodstream or body tissue. I know we went over a lot and not a lot of time, so we're ready for any questions that you might have.
Feel free to drop them in the chat as well.
So while everyone is getting their questions all typed out, I do want to take over for just a moment. All right. So I do want to just show you that Soul M is running a promotion in here. So go ahead and take a look at that. You can also find literature, web links, and some videos. You can also take their survey. And I encourage you guys to hang out in here after our talk is over. We also have on-demand talks, as well as if you click on the labs, you can explore the Thomas Center. And I'll hand it back over to Soul M.
Awesome. So I see 2 questions in the chat. They're fantastic questions. So the first one from Rhonda is, what is the best practice for converting from standard hypodermics to safety hypodermic products? That's a great question, because I think a lot of the times some of the hesitation with converting is, of course, it's a supply chain exercise and it takes a little while to train nurses on how to use the product. But that's really where Soul M can step in. We have Jory and I, of course, but we also have a clinical sales specialist who will come on site, help with converting from your standard to training on the safety product so that you're very comfortable. You have the nurse educators and everyone practicing on the product and understanding how to use it. We also have a ton of materials videos, training materials, product evaluation forms that support the full conversion from, product evaluation all the way to full-blown implementation. Any questions on that for the conversion standpoint? But, just keep in mind, we're here to support the conversion. We really believe in the importance of using these safety products and anything we can do to help. And then let's see, Diane said, do you have any new and innovative safety products coming to the market soon? And the answer is yes. We have a lot coming in terms of new safety needles and safety syringes. I'll, stay a little closed-lipped just to leave, a little bit on the table, but early in Q4 and the beginning of next year, we're going to have some really fun new safety products that are super innovative and make everyone's lives just a little bit easier day to day when administering meds. Any questions or feedback on the presentation, on safety products in general? We'd love to. Sample requests. So I believe Alexandra Ali, who is our Solem sales rep, she will help with any sample requests. We have a sample warehouse where we can just order and ship directly to you. So send us any sample requests and we can definitely get those processed for you through our warehouse. And then any separate trainings that you guys would like on the safety products, we're happy to give to any of your team members as well to discuss the importance and the features. Thank you, Alex. Awesome. So I don't know if you guys all saw the chat, but Alex did confirm, send all your sample requests to her email. It's in the chat and she'll get those processed for you. Just, anyone want to speak up about potentially the safety products they are using today and how they're working for you? All right.
I actually, if you don't mind, Marley, can comment just in some of my experience too. I actually saw that there is a lot of focus on safety features in the animal research market as well, which to me was a bit surprising because I figured, I guess, with an animal, for the most part, it was contained, but there seems to be a higher needle stick injuries there than anticipated. So just touching there for as you look at markets and who to talk to, that's just a good one where this could be found also.
Animals wiggle, yeah, for sure.
All right, if there are no more questions, I'm going to go ahead and close it out. And thank you, Solem, for joining us today. Hope you all learned some new stuff.
Yeah, thank you everybody for joining.
Thank you.
Appreciate your time.
Thank you.